afternoon, everybody. A Beaumont Health patient, a male in his 50s, who tested positive for the COVID-19 and had other underlying medical conditions, passed away early this morning at a Beaumont hospital in Wayne County. Our medical team went to extraordinary efforts to care for this patient, and we are deeply saddened by his passing and empathize with his family. I want to thank our physicians, nurses, and medical staff who are all working together to care for COVID-19 patients. During this time, we are all united to battle this virus, and we must continue to serve and care for the non-COVID-19 needs of all patients, whether they are giving birth, needing essential surgeries, or requiring life-saving emergency procedures. As a health system, we have taken many steps to prepare for COVID-19, and we are expanding our efforts every single day. While we are all saddened by the first death of a Beaumont patient who tested positive for COVID-19, it is also critically important for the public to understand that all efforts underway to stop the spread of this virus and treat people who are ill. I'd like to now turn it over to Dr. Nick Gilpin, Beaumont Health's Medical Director of Infection Prevention and Epidemiology.
This is an unprecedented situation in Michigan and across the country that we're dealing with right now. I'm incredibly proud of our team at Beaumont, and I'm incredibly proud of all my brothers and sisters in healthcare across the country who are battling this situation. I want to talk about Beaumont's response. Beaumont has built a large-scale COVID-19 screening and testing operation. We really need your help in the media to get this message out to the public because we think it's important and it's time to have this conversation. Coronavirus testing is being processed on-site at Beaumont on a limited basis. We simply do not have the bandwidth, the testing supplies to test everyone. On Tuesday, March 17th, Beaumont processed approximately 500 tests. We've also sent more than 1,000 other tests to state and other national labs for testing. Testing facilities are being overrun. I want to be clear that not everyone with COVID-19 symptoms, which includes fever, cough, and shortness of breath, needs to be tested. What I'm calling this is the pivot. COVID-19 is in our community. It's with us. It's not just something that lives overseas anymore. It's in our backyard. And so a lot of patients who are experiencing relatively mild symptoms, who don't have underlying medical conditions, who are young and otherwise healthy, frankly, do not need to be tested because it will not change the way that we manage you from a healthcare perspective. But Beaumont does recommend talking with physicians or nurses on the phone prior to seeking testing if you do think that testing is necessary. And we've also set up curbside screening at all of our Beaumont facilities to help facilitate this. On March 17th, Beaumont staff screened about 1,500 patients at our curbside facilities. We also have a coronavirus hotline. That number is 800-592-4784. That's staffed by Beaumont nurses and staff members. The purpose of this hotline is to help triage people appropriately to the right level of care. If you call the hotline and you don't have moderate or severe symptoms, there's a very good chance that you will not be directed to testing. But if you do have medical conditions that put you at higher risk or advanced age, or if you have moderate or severe symptoms, you may be directed for further evaluation. Beaumont has also put in place visitor restrictions at all of our campuses. We're also canceling non-essential surgeries and other non-essential services such as physical therapy, occupational therapy, speech and language therapy, cardiac rehab, pulmonary rehab, and other non-essential services have been put on pause. The main Beaumont Command Center is helping the entire Beaumont team coordinate and share resources. We're also working closely with state and federal health agencies and lawmakers. We're having those conversations on an almost daily basis. Our mission right now is to protect our patients and the public, but our mission is also to protect our staff. We are providing our staff with adequate PPE, that's personal protective equipment, and we're educating them on how to properly use it. We're also following all appropriate infection control procedures, and we're collaborating with other healthcare systems to make sure that we're all providing the same information to our employees and our patients. I'd like to turn it back over to Susan now. Thank you.
Thank you, Dr. Gilpin. I'd also like to let you know that we also plan to launch an online risk assessment tool this afternoon, later today, which will also help us serve our patients during this pandemic. This online risk assessment tool will assist people who, as Dr. Gilpin has said, do not need to be tested and do not have underlying medical conditions to be able to go on this online to do this risk assessment and to determine what the best steps are for them to take at this time. Again, I want to thank our Beaumont physicians, nurses, and all of our employees for their amazing work in fighting this virus, and I'd like to join Dr. Gilpin in thanking our brothers and sisters in healthcare around the country in joining this fight as well. So now we can take some questions, but please note that we are limited in what we can say due to patient privacy laws.
Ms. Grant, can you tell me where this patient may have gone? This will probably be one of the first questions the public would like to know.
Sure.
Yeah.
We can't talk specifically about which hospital the patient was cared at. It was one of our Beaumont facilities.
I just didn't get into the underlying conditions. Is there anything else you can tell us about this person?
We're still working on getting that information ourselves. We can't really talk about specifics regarding the patient's condition.
Do you have any sense yet of whether it was a travel-related case, community spread case?
There's no information at this time that it was travel-related or community-related.
Are you able to tell us how long he was hospitalized?
We do not have.
Don't have that information either.
Nick, so here's the question. If I'm 40 years old and I have no underlying health concerns, but I start to feel the fever, the and the whole thing, you're telling me that the best course of action right now would be to self-quarantine, call my office and say, look, I've got these symptoms, I'm young, I'm healthy, I don't need to clog up the testing portal. Is that basically what you guys are saying right now to the public?
I could not say it better. I think that is exactly the message that I want to get out to the public. Mild symptoms, young, relatively healthy people without chronic medical conditions, we don't have the capacity to test all of you. There's a very good chance that many of you may have COVID-19, frankly. And testing you is not going to necessarily make a difference with regard to how we treat you. We're going to recommend that you go home. We're going to recommend that you practice social distancing, self-isolation, hand hygiene, respiratory etiquette, washing all your high-traffic surfaces at home, all the usual stuff that we would recommend to anyone right now. That's exactly the recommendations that we're giving to our patients who are coming through our curbside testing also.
Can I ask about underlying conditions? Now, there are underlying conditions and then there are underlying conditions. If I have, I mean, when does the underlying condition become the issue? I mean, there's a huge difference between having rheumatoid arthritis and having cancer. You know what I mean? Like, what, are there some specific underlying conditions that would be more concerning than others? Something that you guys are zeroing in on when somebody calls the hotline?
Sure. So I think with regard to underlying conditions, first of all, our hotline and our online risk assessment tool is just that. It's a risk assessment tool, all right? You can't really screen and diagnose someone effectively over the telephone, but we can risk assess. So when you call our hotline, you're going to be asked a number of questions about your age, about specific medical conditions you have, and the conditions that we're focusing on are the chronic medical conditions like heart disease, lung disease, conditions that compromise your immune system in some way. Those are the things that are going to push you into a riskier bracket with regard to maybe you do need to be seen more urgently than someone that doesn't have those conditions.
And when you're talking about the conditions that compromise your immune system, just for folks who don't know.
conditions that compromise your immune system, so there's lots of conditions. Specifically, they could be medications that you're taking that compromise your immune system, like certain steroid preparations or medications that people take for inflammatory conditions. Autoimmune conditions are often considered immune compromising. Obviously, we have our HIV population and people with chronic infections that we're concerned about as well. Those are considered immune compromising.
So can you tell us about the patient who passed away? When did the gentleman come into the hospital, and what kinds of symptoms did he come into the hospital with?
I'm sorry, I don't have all that information.
Nick, we're already starting to see smaller hospital systems get several ICU patients who are either suspected COVID cases or confirmed COVID cases. Can you guys speak at all to where Beaumont Health Systems is on that? Is it something where it's like a few people are in ICU, it's becoming a larger population? Can you speak to it even generally?
I can generally speak to it. We've tested a lot. We've had dozens of cases within our Beaumont hospitals, all 8 different hospitals. As of right now, we feel adequately staffed and adequately resourced. We're constantly having these conversations with our sister organizations throughout the state and with state lawmakers to make sure that should the need arise, we can have access to things like ventilators and other medical equipment that might be necessary. But I'm happy to say, as of right now, we feel well stocked.
I ask that because I think people are going to want a better sense of if this guy was in the ICU, they want to have an understanding of, are there a lot of people in the ICU with similar conditions, or are most of them, I know not all of them even have to be hospitalized, are most of them in general care? Are you starting to have more in the ICU? Can you give us any kind of sense?
We're ramping up our capabilities to take care of patients in an ICU capacity. I think you need to look no further than what's happened in other countries where this virus has ravaged, frankly. Places like China, South Korea, and Italy really challenged their critical care capacity and their bed capacity. So we are absolutely thinking ahead. The key to infection prevention and epidemiology is trying to stay one step ahead. And that's what we're trying to do on an everyday basis here at the command center.
How do you think this is going to increase in terms of the rates of patients that you're seeing, and what challenges do you face in meeting that? And is there anything the public can do that can help in you meeting that?
Well, for starters, I think you're going to see the number of cases escalate tremendously. And that's partly because you're going to see more real cases, and it's also because our testing is going to begin to catch up. Now you're starting, in the beginning, the state and federal health authorities were really the ones doing all the testing. Now you've seen that testing capability go out to private labs. Now you're starting to see healthcare systems adopt their own testing. So with more and more people testing, you're going to have more and more positives, which mean more and more confirmed cases. But you're also going to see a lot of those patients start to present themselves to healthcare because the virus is also spreading through the community. And I'm sorry, what was the other part of your question?
Is there anything the public, with it increasing, are there concerns about capacity, and at what point are there estimates, projections that you guys are making? And is there anything the public can do to help mitigate what you're expecting to happen?
Right. I think what I want the public to know is if you're not sick, if you're asymptomatic, if you think you've been exposed, call us. Don't come showing up to our emergency department, okay? We need to preserve our precious resources. And right now, our precious resources as healthcare providers are our testing capabilities, our personal protective equipment, our beds, and our staff. Those are the things that are more precious than gold to us right now. And having people come in that frankly are not that sick consumes those resources, and it really hinders our ability to provide care to the ones that need it the most.
How are your people holding up?
It's stressful. I'm not going to lie. It's stressful, and I worry about my staff all the time. But you know what? I've also seen the response here just like I've never seen anything before. I feel like people are banding together. We know we got to get through this. It's mission critical.
What kind of capacity increase are you seeing in order to handle the expected influx of patients?
You want to talk about that? Capacity increase?
Yeah. As Dr. Gilpin said, we've been planning every single day to anticipate a surge of patients, and so we have been reallocating resources so that we can be prepared for when that happens.
What do you say to folks? I mean, when you hear about the first death, in our state, it's scary. What's the message that you want to get out to people?
I want to again say that my sympathies are with the family of that patient. It's a very sad day, obviously, and it's never any good to have a patient die. But I think that we also have to prepare ourselves that there will be more. Just simply being realistic, I think that we're really just kind of seeing the tip of the iceberg here. And we know statistically from other countries and other states that have experienced this on a larger scale than we have so far, that there will be a significant number of critically ill patients. There will be a significant number of patients that will die from COVID-19. But I also want to make sure that we're emphasizing that the vast majority of people who get COVID-19 will recover, and they will recover uneventfully. And that we're talking about a number that's probably close to 80, 85, 90% of people who get infected will recover uneventfully. And I think that's the message I want to hammer, is sure, for a lot of you out there, you do need medical care, and we want to be able to provide it to you. But for the majority of you, you'll be okay.
I want to add to that in terms of capacity. While we're making room and anticipating needs and making sure that we are able to manage any needs that the COVID-19 patients may have, we are continuing to care for and ensure people in our community that we are continuing to care for and meeting their needs. We still have people who have heart attacks, strokes, babies, and we are here for them.
In terms of ventilators, we've heard about other countries running out of the ventilators needed. What is the situation here? Is there a call for the federal government to expedite any process? Is that something you guys are dealing with?
Yes, we are working with state and federal officials to ensure that we have the equipment and supplies we need. It is a challenge right now, but we are continuing on that every day.
How many more would you like?
Can you go back over the figures again once more, if you don't mind? You did 500 tests on Tuesday?
What is the current capacity, total beds across all eight Beaumont hospitals, and what are you running percentage-wise right now?
We have over 3,000 beds. The percentage capacity is constantly changing. We can get that to you.
What can you tell us about exposure to staff and the community from this particular patient? Are there concerns there?
I'm sorry, can you repeat the question?
particular patient today, are there concerns for exposure to your staff? And is it known their contacts in the community? Are they being reached out to, family, friends?
We're being very diligent to make sure that our staff have what they need to appropriately and safely care for these patients, and addressing that as we go along and ensuring that they have what they need.
I want to add that we have a very rigorous employee health system process for making sure that we always vet any exposure to our staff, because again, our staff is one of our precious resources, and we always want to make sure we're keeping our staff safe.
Can you speak to that a little bit? Different hospitals and health centers have evolving policies about who gets a surgical mask versus an N95. Is it due to temperature screens of staff coming in? Can you talk about where policies are right now in that area?
Well, just respect the fact that this is a moving target. I think that's the biggest message here, is that what we're telling our employees and our staff today about PPE use and what our restrictions may or may not be might be completely different tomorrow. I think the big message right now is when employees are exposed to a patient with COVID-19, as long as they're wearing their PPE appropriately, there are no need for any concerns or work restrictions. It's really in those situations where someone, it was an unknown, or maybe someone wasn't wearing their PPE appropriately, that employee health needs to get involved, and we have a process for evaluating that.
Would you consider a surgical mask or an N95? Which one of those are, when you say PPE, what are you saying is sufficient for protection?
I could get in the weeds on, the details, but,
surgical mask or...
Well, so what we're recommending right now is for patients who have confirmed COVID, we prefer an N95 mask. But we're also willing to flex if supplies don't allow for us to use N95s. We feel that a surgical mask is a reasonable alternative. We know that COVID-19 is a pathogen that's spread mostly by droplets, and we know that using surgical masks in those situations provides an adequate amount of protection for most of our staff.
Just take a couple more questions and then they got to go.
There's a shortage of masks and gloves all around.
Yes.
Would a clean towel or handkerchief, rag around your mouth and nose, would that suffice for protection?
I would say not.
Okay.
And I know the man is in his 50s. Do we know the exact age?
They're not releasing that.
I'm sorry, yeah.
Does it matter that there's so much information you can't give us about this individual? Do you think that matters?
I think we're still learning ourselves, frankly.
This testing data that's coming from the state is having a hard time getting a full picture because private labs aren't required to report how many they've tested, how many were negative. I think there needs to be some kind of uniformity to this system fast.
Yeah, I think we do. I think we need to start, testing is important. We want to be able to offer testing. We want to be able to offer testing to our patients. I think in a perfect world, I would love to be able to test everyone that wants a test. Reality is, I can't. I simply can't. And I don't think any healthcare system will tell you that they can right now. And so absolutely, I think it's a break the glass moment for testing, that we need to be having these conversations, and we have been having these conversations with our other healthcare partners, with the Michigan Hospital Association, with lawmakers, with the state and federal health authorities, to really try to free up the capacity to do more testing. Absolutely.
All right, last question.
In the 8 Beaumont hospitals, how many inpatients do you have that have been diagnosed with COVID-19?
I'm comfortable telling you we have dozens. I can't give you a specific number because unfortunately that number seems to move almost hourly.
Thanks, everybody.
Thank you.
Thank you.
And thanks everybody for practicing social distancing, by the way.
Yes.
Appreciate that.